This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday morning on WAJR. Thanks for joining us. I'm Kyle Wiggs sitting in for Dave Wilson, who is out this week, and our guest is Dr. Anthony Roda-Renzelli, cardiologist with the Mon Health System. And Doctor, good morning. Thanks for coming on and joining us.
Yeah, good morning. Thanks for having me.
All right, so you're new to this show. You're new to the hospital, right? You're new to Mon Health System?
Yes, I'm new to the Mon Health System, but not new to the area. So
okay.
That's what's different about me. I grew up here in West Virginia and from the area, basically.
Okay, so you're from North Central West Virginia?
Yes, I'm Clarksburg, West Virginia, but Morgantown now since I started college here. I've lived in Morgantown the most of my life at this point now. So
okay.
Happy to be here.
Give us a little bit of background. Where has your journey taken you prior to arriving here at the Mon Health System?
Well, as I mentioned, I grew up in Clarksburg, Bridgeport High School. After that, came to college at WVU, and due to family and just loving the state of West Virginia, I stayed in the area. Had many opportunities to go anywhere I wanted with my training. Trained at WVU for cardiology. Had great mentors, and that's another reason why I came to Mon Health is I get a chance to work with the mentors who are now my partners.
Mm-hmm.
So it's just a great atmosphere, and being able to stay home. My parents are in Bridgeport, West Virginia. So, and my sister's moving back in town in Morgantown, so everything's just working out pretty well for me right now.
Outstanding. Okay, so the Mon Health Heart and Vascular Center, you mentioned some people that you've long admired that now you get a chance to work with. What makes that group of doctors and the support staff and everyone involved, what makes it special?
What makes it special is you're with a familiar group of cardiologists. So, for example, every cardiologist that I work with here at Mon Health, I've worked with before. Not only have they trained me, I trained some of them, but it just means something when you practice with a group of cardiologists that are on the same page, and we all want the best outcomes and to practice advanced cardiovascular care, and that's what you'll get here. And the other thing that's special about it is you can be, since we're friends, be competitive with each other and push each other to do the best or progress into the future and keeping current with the guidelines and procedures.
You mentioned, there's a key word there, you mentioned advanced cardiological care. Now, it seems like the technology has leaps and bounds just over the past 3, 4, 5 years. Talk about that a little bit and how heart health and heart care has advanced with the technology exponentially just recently.
Yeah, so that's what I mean. It's good that you have a team. Because I've been at other places, you get used to the same routine, but the thing with cardiovascular care is you have to stay up to date and bring in this stuff and read and progress. So with my partners, they're, since I've just started here July 1st, you can see we have cutting edge everything, all the equipment you need. The staff is up to date. The cath technicians know what you want, know what you need, and it's for the best outcome of the patients. And that care to get patients in the hospital and out of the hospital in a timely manner.
Yeah, I guess that's one of the biggest advances, that a heart procedure used to keep people off their feet for a significant amount of time, but now you can, you can go in and get these procedures done. They're much less invasive and they're easier on the body overall, aren't they?
Right, and we all practice the same. Most of us will all of us use a radial approach, but we could go and that's through the wrist, and we could access the patient anywhere. But again, keeping in line with what we're talking about, we want to do what's best for the patient, which is through the wrist approach. And a lot of times with percutaneous coronary intervention, or if the patient gets a stent, they'll go home the same day.
Yeah, that's incredible. It really is incredible. cardiology, let's take one step back. What drew you to this kind of corner of medicine? What drew you to cardiology?
Well, going back to since I brought up Bridgeport, when I was in high school, I always liked coronary or cardiac physiology. So that's where it started. And then I was a biology major, and then one thing led to med school, and then cardiac anatomy and physiology was always my favorite. You could think your way through the diagnosis. You don't have to memorize everything. And you could treat patients in an acute setting and also take care of them over a period of time, and you develop that relationship with patients, which they really enjoy.
Mm-hmm. Where can patients see you specifically? Where can they come see you for their care?
Right now, they can see me in Morgantown at the Mon Health Clinic, and also in Elkins, West Virginia.
Okay, so you spend your time between Morgantown and Elkins.
Yeah, Elkins 1 day a week. So since I am newer to the system, I'm still getting settled in too. But
Right.
It's going to be great.
Yeah, absolutely. We are with Dr. Anthony Roda-Renzelli, cardiologist and a local guy from right here in north central West Virginia, Bridgeport High School, and now part of the Mon Health systems. When you see a patient for the first time, what are the things, where do you start with that patient? Obviously, you ask what their symptoms are, you check them out. How big is family history part of that?
Well, family history is a big part. And a lot of patients that we see just come in, they're not having symptoms because they have a family history. The thing about family history is a genetic predisposition to coronary artery disease, valvular disease, or any cardiac condition. So the thing with genetics, what I tell my patients are, that's the bad thing about it. You really can't change your genetics. So what you have to do is modify your risk factors, stay on top of things, and what can we do to keep this from progressing if you already have a genetic predisposition to a certain cardiac pathology?
Okay, so you avoid those risk factors, and the big three: diet, exercise, and stop smoking, right?
Right. Stop smoking is a big one for me, because that's the one that you could really, even though it's an addiction, it's one that I think is the most important, is smoking cessation.
Okay, give people an idea what they're doing to themselves, what they're doing to their hearts, what they're doing to their bodies as they continue to smoke.
Well, smoking, what it does is, like I said, it's an addiction. It's the nicotine, but it causes vasoconstriction, and it also causes inflammation within the vasculature of the entire body, not just the heart. So that's what I'm saying. You're insulting your body and vascular system with a substance that you're addicted to, but you can put down, and that would really modify your risk for potential heart attacks, stroke, coronary artery disease, blockages, etc.
And it's believed literally the moment you stop smoking, when you put that habit in the past, you become healthier instantly, right?
Right, yeah. And I always tell my patients in a nice way, and they know me, and I said, you have to stop. And they get it, but it is hard to stop smoking.
There has to be some help, right? I mean, there's some smoking cessation programs that people can get help with through Mon. Yes.
And the most successful patients I've seen, they just told me, they said, you know what, I just decided I had to quit, and they stopped on their own. That's where I've seen the most success. But there is help out there through the Mon Health system.
Right. Okay. So stop smoking, increase your exercise, watch your diet. Those are three big risk factors. What are some others?
Well, get screened for diabetes. And if you're diabetes, make sure your blood glucose is controlled to an A1C level less than 7. Most patients know that now. They know that. They're familiar with that number. Cholesterol for high-risk patients and coronary artery disease patients. And most of the literature and data are saying for a bad cholesterol or LDL, get it down as low as you can. So at least less than 100, or an optional goal of less than 70. And also watch blood pressure or hypertension. So the ACC made it easier if you do not have heart disease or risk factors less than 140/90. But if you are a diabetic or have heart disease, less than 130/80 are the numbers to remember.
All right. So unfortunately, all these things are linked: diabetes and your cholesterol and your blood. It's all linked to the heart.
Yes.
Okay.
And those are your modifiable risk factors, as we spoke about.
Right. We, again, are with Dr. Anthony Roda-Renzelli, cardiologist with the Mon Health Heart and Vascular Center. This is Mon Health Talk Radio for this Monday. We'll take a quick break. We'll continue the conversation. Stay with us. We've got more Mon Health Talk after this on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday on WAJR. Our guest, Dr. Anthony Roda-Renzelli, cardiologist with the Mon Health Heart and Vascular Center. And doctor, again, thanks for your time this morning. We appreciate it. He's
Thank you.
New to the system. Let's talk a little bit about the difference between men and women with heart issues. Some of those symptoms can vary a little bit, right?
That's true. So for the most part, between men and women, the symptoms are similar. So for example, men have classic typical angina symptoms: chest pressure in the center of the chest, squeezing, heaviness, or people like to say, in med school, elephants sitting on their chest pain with exertion, shortness of breath when you exert yourself or exercise. Those are your typical angina symptoms: jaw pain, radiation to the left arm. Women, what's interesting about them is they're more likely, in a setting of a heart attack, not have chest pain at all. So those symptoms of chest pressure, heaviness, a woman may not have that, and they have more what we call atypical chest pain symptoms. So they'll present with nausea, diaphoresis, or sweating, tiredness, bilateral arm heaviness, just not feeling well, and it'll be a heart attack.
Okay, so if someone out there is experiencing these, what should they do? What are the first things they need to do to make sure it's not a heart attack, or if it is, get treatment?
Right. They need to go to the nearest emergency room. That's never a bad idea to take an aspirin. Most people have that at home. Take an aspirin and head to the emergency room. And then the bottom line is you need an EKG immediately to see, is this an acute heart attack, where we would do an intervention or take you to the heart catheterization laboratory to place a stent. Mm-hmm. That's the most important thing. And the thing with heart attacks is the term is time is muscle. So you don't want to sit at home and worry about it. You need to do it now. And mainly patients with heart attacks, they know, something's not right. So the main thing is to get that EKG in a timely fashion.
Mm-hmm. So act quickly. Don't wait.
Right.
Don't wait for the next morning to see if you feel better. Take action now.
Yes.
Okay. There are types of heart disease that don't manifest themselves necessarily in a heart attack. What are the symptoms there, and what can people do to try and mitigate some of those symptoms?
You mean if they're having a heart attack?
Well, I'm just talking about heart disease. You've got issues with your heart that don't necessarily you want to take care of it before you have a heart attack, right?
Right, yeah. So it's the same thing. You always talk about modifiable risk factors. You want to make sure that, now they recommend, like you said, diet and exercise. You always start there, but to be honest with you, people forget about that. So what the recommendations are now is 150 minutes of exercise a week. So that means 30 minutes, 5 days a week. And you want to do that first, diet and exercise, along with your medical therapy, quit smoking, and modify those other risk factors that we spoke about. And then when patients ask you about diet, you still want to live your life. So I always say, eat things, but eat in moderation. Yes, you can eat bad at times, but that can't be the norm for your diet.
Yeah. Yeah, if you like hamburgers, it's okay to have once a week, right? But not every day.
Not every day.
And not 5 of them, right?
That's right.
Just have one and enjoy yourself. Okay, when you say exercise, and people may be intimidated by that, 30 minutes a day, it's not really a lot. And when you say exercise, that just means get up, right? Move around, go for a walk the dog. You don't have to go to a gym and try to lift 350 pounds.
No, you don't. You're absolutely right. Is what you want to do is cardiovascular exercise, walk for 30 minutes. You could take a break, but you want to have that constant walk, not steps or anything like that. You need 30 minutes of cardiovascular exercise. And when you think about it, it's not that long when you break it down over a period of days. So, like I said, it's 150 minutes a week, but it's very important that you do that. And then when I see patients in clinic and they've lost 30 pounds, 50 pounds, and they were short of breath before, they come to clinic, they go, I feel great. And honestly didn't change their medicines, they just lost weight, and they feel better.
Yeah, and again, it's amazing what you can do if you start with that 30 minutes. All of a sudden, you build something up, and you're going for 45 minutes, or you're going an hour. So it's kind of small steps first. Yes, exactly. Okay, what else do people need to know? What other things can they do to maintain heart health? We talked about stop the smoking. We talked about the exercise and the diet. What else do people need to know?
What else is they just need to be aware of their symptoms and, just make it part of their lifestyle, a healthy lifestyle, and then they feel better overall. But for the most part, we touched on everything that they need to know. It's just a matter of I always say when I see patients, and when your patients are educated to their symptoms and they know their numbers, it makes it for an easier clinic visit for the physician, because you come in and they say, you could just ask them, what's your A1C? And they go, it's 6.8, and they're happy about it. What's going on with your weight? They say, I lost 20 pounds. How's your blood pressures? And they know. So if you just tell them, look for 130/80 for your blood pressure. So that's how you maintain it over time and prevent things, is you educate the patient to those numbers like we talked about, and then they know that they're on track. Mm-hmm. And when they're not on track, they could come to clinic and tell you, hey, these numbers aren't where I need to be. What can we do? And that's when we titrate medicines, start medicines, or do other things like that.
And it's important to know that the support is there at the Mon Health Heart and Vascular Center. Again, for a new patient, what's the process of kind of getting started?
With a new patient, the process of getting started is, I'm in clinic today, for example. If they don't have baseline blood work, you should start there, get a fasting glucose, check their blood pressure, check their weight, monitor them for smoking, and get a fasting lipid profile or a cholesterol profile. And that's really where you start. Now, if patients need extra help, we have training coaches. The HealthWorks, because I'm still getting familiar myself, has facilities there where they could get structured exercise programs. I've exercised my whole life, so I never needed that, but some people need people to put them on a structure because they just need to learn how to do things the right way. Or am I doing enough? Can I do more? Or build up like you were just speaking about.
Mm-hmm. Yeah, it's just getting started for some people.
Right, and it's education. That's all it is.
Yeah, exactly. All right, and again, smoking cessation, that's available through Mon Health, and of course, people can learn more. We encourage you to go to the website, monhealth.com/heart, and you can get more information on any of these programs. Well, Doctor, welcome back home. We appreciate your time and great information today. Thanks for your time.
Yeah, thank you, and thanks for having me. That was great talk.
Dr. Anthony Roda-Renzelli, cardiologist with the Mon Health Heart and Vascular Center. And that is Mon Health Talk Radio for this Monday on WAJR.